Welcome. Hello, everyone. I'm Pamela Falk. I'm a UN resident correspondent and CBS News foreign affairs analyst based at UN headquarters. Welcome. Hello, everyone. I'm Pamela Falk. I'm a UN resident correspondent and CBS News foreign. I am pleased to be the moderator for today's event, Women's Leadership in the COVID-19 Response to Protect Every Woman and Every Child. Let me first start by thanking Her Excellency, Ms. Kersti Kaljulaid, President of Estonia and co-chair of the high-level steering group for Every Woman, Every Child, and for co-convening this incredibly important high-level roundtable, together with the Right Honorable Helen Clark, the former Prime Minister of New Zealand and chair of the Partnership for Maternal, Newborn, and Child Health. We also thank the partners of Every Woman, Every Child, Askild Jacobsen, the Norway State Secretary, and to Norway for their assistance. Every Woman, Every Child, the global movement to end all preventable deaths among women, children, and adolescents has gathered us here today because we know the COVID-19 pandemic is posing a serious threat to the hard-won gains we've made on women and children's health and well-being around the world. Lessons learned from previous epidemics are foreboding, and the vulnerabilities emerging from and exacerbated by efforts to contain COVID-19 are alarming. Even as we deal with the immediate threat of COVID-19, we simply cannot allow the world to backslide on women, children, and adolescent health. This is the purpose of the event today. We welcome you. During this hour, we want to hear about solutions and approaches to the challenges we are facing so that others can learn and follow your lead. For those watching at United Nations headquarters and around the world, join us at #RiseForAll. Please join us during the discussion. We begin our session with opening remarks from our esteemed co-hosts, Her Excellency President Kaljulaid of Estonia and the Right Honorable Helen Clark. We will take a close look at the devastating impact COVID-19 is having on women, children, and adolescents. Then we turn to action. We have numerous events around the world that have told us what needs to be done. Today, we'd like to have an open discussion about what is being done to protect and safeguard women and children's health. We are honored to be joined this morning by remarkable women leaders for this discussion. Right now, I'd like to welcome Her Excellency, the Right Honorable Governor General Julie Payette of Canada, Her Excellency Ms. S.B. Campbell-Barr, Vice President of Costa Rica, Her Royal Highness Princess Sarah Zayed of Jordan for joining us, along with each preeminent woman leader. Thank you for your leadership. Thank you for your commitment. Finally, the sponsors of the event invite you to join them in a social media challenge that's coming up toward the end to continue fostering action and commitments to protect every woman, child, and adolescent everywhere. So first, I am very pleased as a UN correspondent to introduce a welcoming message from Mr. Antonio Guterres, United Nations Secretary General and Senior Co-Chair of the High-Level Steering Group for Every Woman, Every Child.
I thank my co-chair of Every Woman, Every Child, Her Excellency Kersti Kaljulaid, President of Estonia, for convening this important roundtable. As the world addresses the COVID-19 pandemic, we must safeguard decades of progress on maternal and child health and well-being. The United Nations estimates that 6 months of lockdown could lead to 7 million additional unintended pregnancies and 31 million cases of gender-based violence. Progress on children's health is equally at risk, with routine immunization services being put on hold, scaled back, or shut down. We must ensure that the pandemic does not push more women and children into poverty or further restrict their opportunities. Plans to respond and recover from the pandemic must prioritize their human rights, protect them from domestic violence, and ensure access to services that support health, reproductive rights, access to clean water and sanitation, mental health and education. While women have been among those most severely affected by the crisis, women have also been among the strongest and most decisive leaders in the response. Global solidarity will be crucial. As Secretary General of the United Nations, I am strongly committed to protecting the health and well-being of every woman, every child. Thank you.
Thank you, Secretary General. And now we turn to Her Excellency, Ms. Kersti Kaljulaid, President of Estonia and Co-Chair of the High-Level Steering Group for Every Woman, Every Child. Madam President, you have the floor.
Hi, everybody, and thank you indeed for joining us, Helen and me and Secretary General this morning and afternoon and evening, wherever somebody happens to be. And I'm so happy that we are actually the first organization of the UN, Every Woman, Every Child, which had a video conference option on table already before this pandemic happened, because in early March already we gathered around our screens in order to discuss how to better protect the weakest in our society. So we were the first, and I'm happy we are continuing now, and this is the normal way of operation. You know, 100 years ago, we were all hit by the pandemic influenza, and since then we thought that we now know bacteria and viruses much better and are able to protect ourselves, and this pandemic has certainly humbled us all. And why I convened this roundtable is that I believe that right now we have a much better palpable feeling, us, the people who sit in our, well, relatively safe bubble created by science, economic well-being and education, of the problems of those people for whom our new nightmare actually is the way of life. This is how they live, where vaccines are missing, medical help is not provided, violence and war, they are both part of the normal. And if something positive at all can stem from this pandemic, where we have lost so many lives whom we still mourn and will keep mourning for a long time now, it is the wider acceptance of the importance of global communal goods, fighting climate change, providing healthcare, and supporting the weakest in society, the children, adolescents, and women. Because this virus has also shown that we are not safe unless everyone is safe. Literally, it is this way. And thank you all for finding time to join us and also providing inspiration to continue protecting children and adolescents and women in this crisis. I also raised the issue of the most vulnerable yesterday at the High-Level Security Council discussion on the protection of civilians, because the pandemic clearly poses a new layer of threat to international peace and security, and to women, children, families caught in war, conflict, and crisis. And at the same time, the crisis is also being used by some to call for seizing humanitarian assistance, limiting access to humanitarian assistance, because we cannot move around as freely as we did before. And I think we need to stand strong against these kind of developments. Humanitarian aid must reach the people in the need, even during the time of the pandemic. Because this pandemic has not made all pre-pandemic challenges disappear, but a lot of attention shifting has been going on. And I think it's so important that we refocus on all the problems which have not gone away. The question of domestic violence, the closures of schools, restricted access to basic products, these are the things which are enhanced. They're not disappeared, they're enhanced. And I think this afternoon, these are little steps what we are taking, but they're somewhat different. Traditional tools are not sufficient. And I thought, let us try to do things differently, reach out more at grassroots level, hoping to build new compassion by informing those who have never thought too much about how hard life can be, going at the grassroots level. It might inspire action, new resources. It might inspire new technologies even to protect, provide, and simply help to survive. Thank you for joining us.
Thank you so much, Madam President. We now turn to the Right Honourable Helen Clark, former Prime Minister of New Zealand and Board Chair of the Partnership for Maternal, Newborn and Child Health. Madam former Prime Minister, you have the floor.
Thank you very much, Pamela, and greetings to my co-conveners, President Kersti, and all distinguished participants and everyone watching us online at midnight New Zealand time. I guess we've all come together because none of us are prepared to stand by and see this pandemic erode the significant progress that has been made on the health and rights of women and children and adolescents. We see COVID-19 now for the deadly and disabling disease that it is. And we're also seeing those many impacts of a global crisis which the pandemic has created and how they are magnifying inequalities around our world. So often in addressing past pandemics, the health and rights of women, children, and adolescents haven't exactly been top of mind. So the services they need haven't been properly resourced. Their voices haven't been heard. And often we don't see women at all prominent in decision-making about pandemic responses in many countries. We're now seeing the economic impact and social impact of this crisis unfold in the increasing poverty and the increasing hunger. We see the first victims of those who were already struggling. We see fragile health systems crumbling. These spillover impacts, so-called secondary effects, but dramatic effects, are huge. We see sexual and reproductive health and rights suffering, especially in these circumstances. And we know that children will suffer lifelong impacts if they miss out on their immunizations and if they grew up in impoverished families with fewer opportunities, including for schooling, as a result of the pandemic. Just on the eve of this summit, President Kersti, along with Graça Machel, Mexico's health secretary, and with me, have had an op-ed published where we highlight 3 priorities for the pandemic response now for the demographic that we've come here to focus on today. The first is that health services for women, children, and adolescents must be protected. And those include services which can respond now to the rise of gender-based violence and child abuse, and also maltreatment of health workers. Secondly, we say health systems just have to be strengthened to secure immunization and primary health care overall, and to expand universal health care out to underserved areas. Women, children, and young people also need support to carry on using health services, where access becomes rather difficult in curfews and where public transport goes. And thirdly, we make the point that all of us as stakeholders, whether we're governments, civil society, philanthropy, private sector, whoever we are, we have to work together. And we have to commit to engaging women, children, and adolescents at decisions about pandemic responses, as the decisions that are being made are going to profoundly impact on their lives. We've seen in the global response, which has been somewhat patchy to date, nonetheless an unprecedented commitment around the development and supply of vaccines and tests and treatments for COVID-19, and to making them available and affordable for everyone, everywhere. We need much more global solidarity now around protecting the health and rights of women, children, and adolescents. I think it's appropriate in this round table, focusing on women's leadership in the response, to salute this group of remarkable women leaders at the national level who have worked effectively to protect the citizens of their countries. And those who have succeeded, we have seen engaging their communities, acting on sound advice, and being always transparent and effective communicators. They have provided models of leadership which everyone should strive to emulate. So let this virtual summit now be a turning point in focusing attention on effective action, which will support and engage women, children, and adolescents in response to the quite extraordinary crisis brought about by this pandemic. Thank you, Madam Moderator.
Thank you very much, Madam Prime Minister. We miss all of you at UN headquarters. Someday we'll all be back. The next panel, I'd like to introduce three very formidable women leaders who are going to speak frankly to the threat that COVID-19 poses to women, children, and adolescent health. Ms. Henrietta Fore is the Executive Director of UNICEF. Ms. Katja Iversen is the President and CEO of Women Deliver, and Ms. Michelle Bachelet is the United Nations High Commissioner for Human Rights and former President of Chile. They will address the threat of COVID-19 to women, children, and adolescent health and well-being. Many of you have likely seen the startling statistics recently released by the UN Population Fund and UNICEF on the predicted toll the pandemic will take on women and children. Now, Executive Director Fore, an estimated 116 million babies will be born under the shadow of COVID-19 and the pandemic. In the approximately 9 months since the coronavirus pandemic was recognized, why does this cause UNICEF concern, and what is UNICEF doing to ensure continuation of essential health and social services? I turn the floor to Executive Director Fore.
Thank you very much, Pamela, and good morning, good afternoon, good evening to everyone. It's really a pleasure following Helen's remarks to see all the women leaders. It's just a treat. So the reason we are so concerned is that as these mothers began on the journey of parenthood, they really didn't think of a world that was going to be a world with COVID. So their world has changed significantly, and it means that there is much concern and worry about how they will be a parent, how they will be a mother, and how they will access services. We're concerned because it is often difficult in many countries to actually have access to services. In some countries, services have been delayed or paused. In others, it is that mothers are very worried about even showing up at a community health clinic. They do not know if they can get their basic services. So there is a great concern that lies in the world today. There recently was a report that was published in The Lancet by the Johns Hopkins Bloomberg University. And it said that we could face an additional 6,000 child deaths every day over the next 6 months if, because of lockdowns, we're unable to have ongoing services. Half of those deaths would be newborns. And that is a sort of a statistic that we want to avoid, that we want to stop as a world. We are very concerned because of the access to services. We're certainly concerned about one that the President Kersti and our Chair Helen have talked about, which is that in the poorest countries and in the poorest sections of those countries, the women are the most vulnerable. And for many of these women, they are young mothers and they are first-time mothers, so they are especially vulnerable. But we're committed to work with our partners to strengthen the healthcare systems and to give access to all of the women who need help.
Thank you very much. Troubling statistics. Thank you, Executive Director Fore. Ms. Katja Iversen, President Iversen, we know that COVID-19, I now turn in this panel, we know that COVID-19 is threatening many of the important steps forward that we've taken on gender equality and women's rights. Can you tell us what women from the most vulnerable communities are experiencing and the impact that the pandemic is having on key women's rights issues? Thank you, President Iversen, you have the floor.
Thanks. I could get used to that, President. I was just keep it coming. So we know that as the COVID-19 pandemic spread, it is pushing healthcare systems and systems to their limit. Right now, we have government healthcare providers, service deliverers. They have to make some very, very key and very difficult decisions about what is essential care and where resources are being diverted. But let me be very clear. Sexual and reproductive health and rights and women's rights, but particularly SRHR, that is essential care. And it is more essential now than it has ever been before. I'm sorry to break it, but people still have sex. They still need contraception during a pandemic. And we know that girls and women get pregnant, wanted or unwanted, and they still give birth. So we very much still need available contraceptives, maternity wards, and sexuality education. We know from earlier pandemics that maternal and sexual and reproductive health and rights are taking a big hit. And we already see that money is being diverted away. Staff is being moved, stockouts are real, domestic violence shelters are being turned into COVID wards. The projections say that 47 million additional women could have an unmet need for family planning in just a couple of months, and that we could see 7 million more unwanted pregnancies. So the consequences are dire, and they will be tremendous in lives lost, but also socioeconomically. Because if there's anything that's really clear now, is that women carry the societies. We need to act, and we need to be smart and stand united. The gendered implications of COVID extends way beyond health. Domestic violence is on the rise, economic stability is impacted, women in the formal economy suffer, and we see that women's unpaid care work just spikes. So we need a full gender lens across all response and recovery efforts. And so while we see progress, not least from the UN and some of the policy papers going out, the gender lens is missing in many key areas and in many countries. But we, this collective we, both the viewers and the people here, can change that. With a gender lens to our response and recovery, we can lay down tracks for a better and a more gender equal world tomorrow, and potentially even overcome some of the big barriers that we've been struggling with for decades. Imagine if we could get out on the other side of this crisis with data that is sex and otherwise disaggregated, with more women in leadership, with proper recognition of the value of health and social workers, including their pay, and with redistributed unpaid care. That would be a much stronger and a much better society for all of us. Imagine if that can be the new normal. And I know that we can build it together, but it requires both a systems change, an investment change, and a mindset change, and it has to start today. So we're calling, and Women Deliver, for the full gender lens and the gender marker to all things COVID. The needs, the wants, the work, the voices of girls and women must be front and center in this response and recovery and in the leadership of it. So we work with everybody who want to do this, everyone who want to rise, and everyone who want to deliver for good. Institute the gender lens, safeguard sexual and reproductive health and rights, and encourage those investments. So we want that gender equal world because we know that it is healthier, it is wealthier, it is more productive and more peaceful. So the big encouragement to the distinguished speakers here and to all the listeners, step it up, safeguard, and use the gender lens. Thank you.
Thank you very much, Ms. Iverson. A reminder to all those watching here and around the world, Rise for All is the hashtag. We now turn to the former president, Ms. Michelle Bachelet, the United Nations High Commissioner for Human Rights. High Commissioner, may we ask you, what trends are we seeing in terms of human rights impacts of the COVID-19 pandemic on the human rights of women, children, and adolescents. Madam Bachelet, you have the floor.
Thank you, Pamela, and thank you for inviting me as a former co-chair of Every Woman, Every Child and former board chair of BNMCH. So it's really, I feel like home, and with all these great women. Well, I think, as it has been said already, that the consequences of the pandemic will be severe on the disease itself, on the measures of response, also on the social economic impact, and particularly if there is not a gender lens, as Katja was just mentioning. Because, and we believe then that it's a real risk that women's, children, adolescents' health is under great threat of being reversed. UNDP has calculated that if this pandemic has the devastating socioeconomic impacts that they have calculated, it will bring 7 years before the development of countries. I mean, this will impact countries who have been able to progress in many different areas. It will be really in a bad shape. But we have already mentioned that one of the very important and awful things that we've seen is a surge of gender-based violence in countries under lockdown orders. And for too many girls and women, staying home is a dangerous option. And you mentioned that UNFPA has given some new numbers and figures that on the lockdown in 6 months. I think the Secretary General mentioned it as well. That will be 31 million additional cases of gender-based violence, another 50 million cases for every 3 months additional of lockdown. Of course, there's also an impact on women's and girls' ability to access sexual and reproductive health services, and that can have lifelong consequences. And UNFPA again has estimated that 47 million women will not have access to family planning, and if the lockdowns continues for 6 months, we can expect 7 million unintended pregnancy, and that also can lead to an increase of unsafe abortions, further risking women's health and lives and children and young children as well. And also, it was just mentioned by Henrietta, the impact that it will have on children and adolescents. But one other thing that I've been seeing, and that will affect men and women, but particularly because women usually are more discriminated in society, it will have a big impact, is that many of the resources that were in other plans of health plans that are really killing people, like malaria, HIV/AIDS, or tuberculosis, among others, will be diverted to COVID response. And of course, as it was said, also diverting money from vaccination, from shelters for protection for women by victims of violence, and also, of course, of sexual and reproductive health and services. But the other important thing I want to mention as well is that, because it's also about the welfare, the well-being of women and their families, and the impact that will have on the children, is the economic fallout of the crisis, because there are 740 million women working in the formal economy globally with no paid sick leave or family leave, no health insurance, or no social security. For example, in Tanzania, more than half of all women are working in the informal sector, depending on public spaces or social interaction, which are now restricted. Women are also concentrated in hard-hit past businesses, such as tourism, and they will be more likely to lose their jobs. In Italy, only 50% of working-age women were employed before the crisis. Or on the 4th of May, the first businesses reopened, 72% of those who went back to work were men, because there were this business considered with less risk, like construction, that are male-dominated. So even though it will be affecting all women, not all women are the same. And that's what is so important, not only to have the gender lens, to have the lens of and have disaggregated data, but also to understand that there are some women that are much more vulnerable than others. And that's what we have been doing, making advocacy, working with country teams, with the UN country teams, working with governments to ensure that those women, such as minority or indigenous women, women living with disabilities, women with HIV, women in humanitarian settings, older women, adolescent girls, women who are criminalized because of their sexuality or sexual conduct. In there, the COVID crisis exacerbated the inequalities that they already experienced before the outbreak. And let me give you a couple of examples. The data from the UK shows that Black women are 4.3 times more likely to die from COVID-19 than their white counterparts. And similar trends are being observed in the United States. And according to the UN Women, due to pandemic, 8.5 million migrant domestic workers with insecure contracts are facing income loss and great risk of abuse, exploitation. And also a recent survey has reported serious disruption in access to healthcare for women with disabilities, and that will have a big impact on their physical and mental health. How to build better? Well, first of all, I think we cannot go to the day before COVID-19. We have to understand that COVID-19, what has shown and laid bare, are the immense inequalities in the world. And women are one of the ones who suffer a lot of inequalities and discrimination. So we need to think better how we're going to do, how we're going to ensure that they are based in human rights. And because on one hand, it shows us the problem, but on one hand, it shows us that we can do things differently. So we can also look at it as an opportunity to do things better. So we have to think on, now that we are 25 years after Beijing, that where the plan of action was adopted, that we have an opportunity to put in place a new way of operating based on human rights and with women at the forefront. And I have to say, and to President of Estonia as well, that from the 12 countries that were considered most successful in the handling of the epidemic, 7 were led by women. So I hope that also is an opportunity so women's leadership is recognized. And finally, I want to say that we have to strengthen health system, prioritize services only required by women, and also see that laws and policies which create barriers to women's healthcare are reformed, and that harmful gender stereotypes, which for instance presume that all women are destined to be mothers, are dismantled, but essentially as well, participation. Women must have to be part of the solution. Women have to ensure on member states, civil society has to ensure that they respond to the crisis now, but also in the recovery, women's participation and their voices are strong, because otherwise our responses as usually won't be as adequate as we need. Thank you very much, Pamela.
Thank you very much, High Commissioner. I would like to say, to maximize time, we've put very accomplished women's bios on the Every Woman, Every Child website, so please go to those for all of the accomplishments. Thank you, High Commissioner. I now turn the discussion to immediate steps to safeguard the gains for every woman and every child. What I'd like to do is open the discussion with a question to our government leaders. Today we have Her Excellency, Ms. Julie Payette, Governor General of Canada, and I may add a former astronaut since it's in the news. Her Excellency, Ms. Epsi Campbell-Barr, Vice President of Costa Rica. Her Excellency, Dr. Awa Marie Colsec, Minister of State to the President of the Republic of Senegal, and Her Excellency, Ms. Gabriela Cuevas Barron, President of the Inter-Parliamentary Union. I first turn to Governor General Payette and Vice President Campbell-Barr to ask, what are the immediate steps you are taking today to protect women and children in the context of COVID-19, including to prevent a backsliding in the progress we've made on reducing maternal and child mortality, particularly among the most vulnerable communities? I turn to Her Excellency, Governor General Payette. I'm going to ask our technical team if there's any issues.
Yes, the issue was mine. It's solved.
Ah, good, wonderful.
Bonjour tout le monde. Hello, everybody. I am here in Canada, probably at the antipode of where Helen Clark is sitting in New Zealand right now. But I'd like to tell you a story first. When I was young, about 9 or 10, I wanted to become an astronaut. But there was no such thing as female astronauts anywhere in the world, and there was no such thing as a Canadian astronaut. But I was encouraged to get an education and to follow my dreams, and I flew twice in space. When I decided to have a family, I chose when and I chose how. And even though there were a complication at birth of my son, like there is always, so still too often, we were taken charge and we were provided with services immediately. He is today a very healthy, tall adolescent. He has never known war or hunger, but he studies them. And interestingly, I wouldn't be surprised he goes and works for the UN one day. We are privileged. Where we are from a country where we strive and we work hard in order to diminish inequalities, to lend a hand to the vulnerables, where we are trying to empower girls and women in every single sphere of society, where we make concrete action to achieve equity, parity, diversity, inclusivity in all decision-making that is happening. But that's my story. I think it could be the story of President Kersti, whom I thank for asking me to participate. And it could be the story of most of us. The problem is that it is not. We now know that the COVID-19 pandemic has increased this inequality. We know that this global crisis will likely exacerbate these inequalities and reverse the development gains that we've achieved, in particular for women and children. This hard-won progress is threatened, not by the disease itself, as was mentioned by President Kersti, which clearly affects everyone. It doesn't discriminate, but it does discriminate in its application and in the ravages it gets through more marginalized people, those homeless, those who are poor, those who are fearful of and have a lot of household responsibility, those who cannot control and decide everything. Will we really see a huge increase, and how much this increase will be in maternal health death or children death or exacerbated problems? Well, that we will have to see. Clearly, the confinement is very preoccupying. The lockdown is increasing, for most probably because it didn't take a break. Domestic violence and external violence, perhaps food insecurity, definitely financial issues and impacts. Essential care is difficult to have. We can choose a better future, and we must work together for this better future. But for this, we must gather the data right now. We must analyze it, starting now and continuing into the future, and take action. I trust that science will find a solution and get us out of the pandemic in due time, finding treatment and vaccine. I trust the resolve of leaders, just like we see in this panel, to make effective action plan and to take the lessons learned. I know that education is key, not only for girls, but for everyone. But ultimately, it is the people that will get us out and see us through the future. Just as much as this disease right now is kept at bay because every single one of us has accepted to work together, to stay confined, to stay put, and to not and restrict our movement so that we can save the lives of others. In the end, I really think that it's only together that we can solve this immense problem and protect and ensure the health of women and children for now, ever. I would say that together we can and we should not leave anyone behind. So I'm very happy to be here to raise for all. Thank you.
Thank you so much, Governor General. Inspired as all of our speakers, I should now say government leaders, opinion leaders, activists, UN officials, and an astronaut. So thank you very much. Reminder, Rise for All hashtag. We are apologizing in advance that everyone has limited time. We are moving on, and I now call on Her Excellency, Ms. Epsi Campbell Barr, Vice President of Costa Rica. I am checking with our technical team. We might move on and come back to the Vice President. No, here we are.
Do you listen to me now?
Yes, bienvenida.
Thank you very much. Thank you. Good morning, everyone. Let me commend the outset of Her Excellency, Ms. Kersti Kaljulaid, President of the Republic of Estonia, and the Right Honorable Helen Clark for their leadership and this very important initiative. And thank you for the honor to address in this high-level roundtable. We pay tribute to the leadership of women that work here in Costa Rica in the front lines of the public health response to COVID-19, accounting for 61% of Costa Rican health personnel, but also all women are that leading the path for a better and more equal and just and inclusive recovery. More than 2 months after detecting the first case of COVID-19 in Costa Rica, our country has committed to coordinate inclusive science-based and human rights-based response to prevent community transmission. We have more recovered than active case, and we registered the lowest mortality rate in whole the Americas. Every human being in the national territory is entitled to receive access to diagnosis and treatments to COVID-19 without any discrimination. In the economic sphere, the program Protect a monthly individual transference to workers affected by the pandemic was launched at an early stage and has now reached more than 414,000 people. This program represents the highest amount of transferences in this kind in the region, according to the UN Economic Regional Commission. The government of Costa Rica is devoted to defeat this pandemic, but also to ensure the consolidation of a more just, inclusive, and diverse country. The new normality has to be gender equality, and where the voices of all women and girls are heard. To that end, the Council of Women has been created as a space of dialogue to formulate proposals that are responsive to women and that are contributors to democratic governance of the country on issues such as social inclusion, economic recovery, and environment. Nature-based solutions are crucial for a better, greener economic recovery. That's why we announced last week the initiative Plus Women Plus Nature that will provide economic support for women environmental defenders and biodiversity managers. Finally, the President of Costa Rica, Carlos Alvarado Quesada, is leading with an invitation for solidarity for the realization of equitable global access to COVID-19, health technologies, diagnosis, treatments, and future vaccine for all. We call upon the global community to commit to the highest aspiration of solidarity and international cooperation in these unprecedented times for humanity. As Vice President of a peaceful and unarmed nation, which has demonstrated for more than 7 decades that it's possible to live in harmony, I truly believe that abolition all forms of violence and discrimination will be an extraordinary mission to lay the foundation of more equal, inclusive, and democratic country where all the human beings, including all women and girls, are respected and part of its construction. Let's dare to be part of the generation of women leaders that takes that step, please. Thank you very much.
Thank you very much, Madam Vice President. We appreciate your intervention. We now move on to brief interventions. We're trying to get through an awful lot of people and so many very accomplished women. So thank you, Madam Vice President. What is the urgent message you would convey to your peers on how to step up efforts to protect women is our question to Her Excellency, Dr. Awa Marie Colsec, Minister of State to the President of the Republic of Senegal, and Her Excellency Gabriela Cuevas Barron, President of the Interparliamentary Union. I turn it to Minister Colsec.
Thank you. Thank you so much. I don't know if you see me.
Yes.
Okay. Thank you. And good morning, good afternoon, good night to a lot of you. And thank you to be invited to this panel. Your question is very straightforward, but let me just say that with my position at the presidential office, my role is more to advocate for women and child access to health services, because as a lot of people have stated, it is one of our problems. Because the services are overwhelmed, but also the resources are diverted, and people also are afraid to go to the hospital or to the health structure. All this is very important for them also to know that with barrier measures, they will be able to do that. We work also on all the social economic impact. This is for me something also very important we can share with you. And the last point, because I am also chair of the transparency initiative for in the mining and oil industry, I have asked for a study on women and mining and oil with COVID-19. But let me say that we need also all of us to be involved in community-based action, because changing behavior, a lot of things will be done at community level. It is why I would like just shortly to share with you the fact that I am also sharing the chairperson of Comeva, a citizen grassroots organization of thousands with up to 90% of women and young members. Most of our activities are community-based, and for COVID-19, we have trained our members, organized information session and demonstration on barrier measures, targeting also women in markets. The young people have successfully organized poster campaign, distribution of hygiene kits and also food for vulnerable population. And what I can say, which is very important also, we have used our network in social media to post video featuring our members, music and sports stars. They help sensitize, particularly women and young people, on prevention strategies, their own safety and the one of their elders. We are also promoting death relief for Africa, because we think that we will have a so huge impact, socio-economic impact of COVID-19, that it is important also that women leaders and grassroots women take this on board. This is the contribution I can say I have been involved in, and I think that all of us, we are very busy on that, but all of us need to do, if it is small, it is still important. Thank you.
Thank you very much, Madam Minister. I now turn to Ms. Gabriela Cuevas Barron, the President of the Interparliamentary Union. Thank you very much, Madam.
Thank you, and thank you very much for this wonderful invitation. It is great to be here with friendly faces. Michelle, so great to see you. Madam President Kaljulaid, Helen, of course. Thank you very much for this wonderful meeting and the lead of having these virtual meetings of the steering committee and these wonderful conversations. Yes, we too are in the middle of a health crisis, but also we are starting an economic crisis. We already had a climate crisis, and unfortunately, some countries, some latitudes are also experiencing a political crisis. So the parliamentarians of the world, that's why IPU is here, we're translating our organization to become a platform for the exchange of the best practices. I mean, just about a month ago, 2 billion people were living in countries where their parliament was restricted or not working at all. So that limits the function of a democracy. And that's why we are working with each parliament, collecting the best practices and sharing those into our website and social media, just as Awamari was saying. But our work, of course, is not going to end there. We know that this pandemic is going to have enormous consequences. Yes, today we are mourning, and we are also trying to prevent more deaths and more sickness. But at the same time, we need to understand that this is going to create problems that perhaps we haven't seen. And those problems are going to have a bigger accent on women and girls, and of course, in children in general and adolescents. So I think that we need to use this important sensitivity that the world is having now in terms of health to understand that if we do not have universal health systems in each country, each pandemic is going to become a tragedy instead of something that we can prevent. So now we have the lessons, now we have the awareness, now we have full attention in health, and this is the moment to act. This is the moment to work between parliaments and governments to change budgets and to give more attention and priority to health. Again, prioritizing women and girls. And of course, you were mentioning, some of you mentioned about the economy. We're starting to feel unemployment, and that's going to affect more women than men. Informal economy has more women than men. Access to social security or even to health is more restricted to women. So we need to understand that those economic challenges in terms of poverty, hunger, unemployment are going to be here. And we need also to work with parliaments to bring us solutions, to bring responses and answers to women, especially for those who are heading their families. For example, I am from Mexico, so hello from Mexico. Here in my country, 1/4 of the population depends on the income that women are bringing home. So if all these women are going to be feeling the tragedies and the scourge of an economic crisis, well, there we're going to see the results. Then on the climate crisis, we cannot deny that regardless of the decrease of the emissions during the pandemic, climate is continue being a problem. So displacement, all the different challenges for smaller rural or communities that are closer to the sea is going to become a huge, a more important problem. And again, this is going to affect women because women represent the most important percentage of refugees, immigrants, or internal displaced people. I believe that we need, and this is the best place to say it, but we need political will. I am very proud and honored to be here with the women that are leaders, not only nationally, but worldwide. And we need to replicate this political will, because unless we work with parliaments in terms of bringing SDGs to national legislation, translating international commitments into local realities, changing budgets to prioritize women, girls, and adolescents, if we don't do that, nothing is going to change, and it is going to be only a beautiful narrative. These are exceptional circumstances, but these are not the reason to stop working in parliament. These are the moments where politicians, where civil society, where NGOs, and where especially multilateralists is more needed than ever. So please be sure that the IPU, we are working as a World Organization of the National Parliaments, but we are also working with the national parliaments to make these laws, budgets, and oversight a complete reality. All best from Mexico. We wish you health and a lot of blessings in these very complicated moments.
Thank you so much. And thank you all for these very important messages. And remember, #RiseForAll, keep the messages going. I'd now like to turn our focus to the global response. We have an incredibly accomplished panel coming up with Her Royal Highness, Sarah Zaid of Jordan, Ms. Gerda Verberg, coordinator of the Scaling Up Nutrition movement called SUN, Dr. Mary Ann Etibel, the lead and executive director of Merck for Mothers, Dr. Amy Pollock, the director of Maternal, Newborn, and Child Health at the Bill and Melinda Gates Foundation, and Ms. Jaithma Wickramanayake, the United Nations Secretary General's Envoy on Youth. Incredibly accomplished panel. And I'd like to start with Princess Sarah of Jordan, Princess Sarah Zaid. Would you please talk to us about the global response? Thank you.
Thank you very much indeed. I have the great privilege to work and travel with the World Food Programme as a special advisor for maternal and child health and nutrition, working to integrate and ensure that programs and policies are centered around the needs, vulnerabilities, and contribution of women and girls. In my work, however, the only women, girls, newborns, and children that I meet have already been left far, far behind. Their lives rooted in inescapable cycles of poverty, malnutrition, ill health, poor levels of education, food insecurity, and chauvinistic systematic exclusion. The impact of these lasts for generations. The complexity of needs and challenges for women and girls in humanitarian and fragile settings, where crisis, contagion, or conflict have already devastated health and health-enabling systems and broken the social contract between government and people, cannot be overstated. Nor can the fact that they are not and cannot be addressed by the existing development and humanitarian architecture. One thing that the pandemic has shown us is how very rapidly government, organizations, communities, and systems can change very fast when they need to. And we need this change in our own system. And I have 4 suggestions. Long-term flexible financing. Currently, less than 10% of humanitarian financing is multi-year. My second point echoes Dr. Alba Marie. The need to increase direct support to national civil society organizations and communities, especially women and girl-led organizations, and especially women and girl-focused organizations. Currently, of the $2 billion of COVID humanitarian response plan that is being requested, 95% is for the UN, rather than the partners who are on the ground and leading the fight on the front lines. My third point is making visible the invisible. And as Henrietta has already pointed out, almost half of under 5 mortality is newborn mortality. And the majority of that is taking place in humanitarian and fragile settings. And this is an area that has to be prioritized and not overlooked. And lastly, support, protection, and empowerment of humanitarians and health workers. They are doing extraordinary work in often the harshest of conditions, and they deserve our collective outrage each and every time they are attacked, killed, or threatened. Thank you.
Thank you very much, Princess Sarah. Your message is very important. I now turn to Ms. Gerda Verberg, coordinator of the Scaling Up Nutrition movement. Thank you again.
Thank you very much, organizers of this very important meeting. I agree with most of the things that have been said so far, especially when it comes to the extra vulnerability of women and children. So I would like to point at a few potential ways forward, how to build the future in a more effective way for women and children. And I would like to stay close to all of us, being a leader, being also a woman. And I propose to be much more aware of the fact that we can do very effective multitasking. And I would like to propose multitasking on several levels. We are all advocate and ambassador for women and for children in several ways. And whether it comes to human rights or to sexual reproductive rights, or when it comes to children, we can use our voice also when it comes to the momentum that we are requested to advise on things. We can use our leadership, not only at the global level, but to make sure that given the fact that the Sustainable Development Goals are a country-driven approach, that in-country activities, the approach is taken bottom up, building upon what is already there. But I also make a strong advocacy on being a more vocal family member. We are all daughters, maybe mothers, grandmothers, aunts, or sisters, and we can influence our brothers, fathers, grandfathers to take a different approach and to invest in women, because not investing in women and girls is missing half of the opportunity potentials. And I think we all underestimate our role as a role model. At least I do it myself, and then I hear from people that are looking at me and taking me as a role model, and I think, gosh, I should make more use. But we as women are very often too modest. Don't be modest anymore, please. And then I think the other part that we need to take on board is because we all have a different lens, and I agree with all the lenses, but we need to bring also global agendas together. Focusing on universal health coverage is a no regret, but it will become a win-win if you easily include good nutrition for young born children and taking care of adolescent girls and pregnant and lactating women, because then they are much more resilient to whatever it takes also to prevent and overcome a virus like the COVID virus. The connection with our food systems. Much of our food is produced by smallholder farmers, and many farmers are female farmers, not getting a fair price and only focusing on yield improvement, not on the quality. Let us reward them better, and let us also pay them for their climate contribution, because if they are able and enabled and praised for their contribution to our natural resources, we're also saving the planet, creating a better future. Finally, I would like to focus on education. Over 300 million children are depending on food meals, school meals, nutritious school meals. And we know that parents make a decision to send also their daughters to school if there is the provision of a nutritious school meal, because then they have to feed one mouth less at home. It can also be a very, very strong tool. But by bringing these parts of the agenda together, the global agenda together, starting from country level and taking our own role as role models and strong female leaders very serious, it can boost a strong way forward. Thank you very much for having me.
Thank you very much, Ms. Verberg, and for an important message. We now turn to Dr. Marianne Etiebet, the lead and executive director of Merck for Mothers.
Thank you so much, Pamela. Can everyone hear me?
Yes.
Great. So I live in Brooklyn, one of the epicenters of the COVID pandemic, and I've been volunteering in one of our local hospitals. And it's so clear, when you walk the wards, how COVID is just laying bare the inequities that we have in our society. And as lead of an organization that has pledged to help end preventable maternal deaths, we talk about how maternal mortality not just reflects the, is not just a vital sign of our health system, but is also a vital sign of our society. And I think all of us have a heightened awareness of that right now. And I propose also we're in a moment of heightened opportunity and possibility around bringing together so many different stakeholders about the underlying underlying conditions that are really driving poor health outcomes for women and children. The pandemic, has come at a time where we are nowhere near hitting our SDG goals for maternal mortality. In fact, I looked at one data point that said, we won't hit the SDG target for maternal mortality until 2085, not even in time for our grandchildren. And I'd like to thank, UNICEF and UNFPA with the research that you did, modeling the potential, the impact that we are looking into around how COVID will result in even more deaths, for these groups. And when we speak to our partners, we are seeing that this is already playing out. In India, with the nationwide lockdown, there are already reports in 43% reductions in institutional deliveries because of the lockdown. In Nigeria, we are already hearing reports that antenatal care visits are down over 50%, and skilled birth attendance is down 40%. So we are looking to women leaders at the front lines, the nurses, the community health workers, the midwives. They are telling us what's already happening. And with the points that so many of you on this call have made about how we need to ensure that essential services are still provided and provided safely, I'd like to add 2 more points to that, because it's not just about the supply of the essential services. We actually have to understand what's going on in the minds of women in their homes and in their communities, and making sure that they are linked in the right ways to the health system, so that they have the right information at the right time that they need to make the best decisions for themselves and their families as they seek safe healthcare options. And that brings me to the role that private sector can play here, because we are already seeing an upsurge in the use of technology to reach and connect with women and communities. And we have to make sure that this is done in the right way, in an equitable way, so that we don't, repeat the inequities that we see in access, physical access to services, as we see folks deploying technologies to support distanced access, to services. And make sure that the work that's done now in the emergency of COVID, that sets the foundations for what can happen post-COVID. The other point I wanted to make, and this follows up on the point from Princess Saeed and Dr. Kulsek, is making sure that our responses are multi-sectoral, that they are integrating local civil society, that they are also integrating the local private sector, local healthcare providers, local social entrepreneurs. So many of them are women leaders in these countries. And we have a responsibility to support the work that they are doing, often without tools, often without resources, but because they live in these communities and they're trying to serve them. And so I know we're running out of time, but at Merck for Mothers, we're really thinking about how our responses within COVID, can really work towards strengthening health systems by bringing the capacity of whether it's private sector or non-healthcare partners into strengthening integrated health systems, and remembering at the end of the day that health systems don't stop at the facility, but the focus, the node of health systems should be that woman in the center and how it is that we reach her. Thank you.
Thank you very much, Dr. Etibet. Very important messages all. I now turn to Dr. Amy Pollock, the Director of Maternal, Newborn, and Child Health at the Bill and Melinda Gates Foundation. Thank you so much, all of you, for being here. Dr. Pollock.
Good morning or afternoon or evening to all of you. It's a privilege to be here, and I want to start by thanking every member of the panel for everything that you do to champion and protect the health and well-being of women and children around the world. it's certainly a testament to see everybody here today in the midst of this crisis participating in a panel like this. We know that the COVID-19 pandemic is exposing and exacerbating the roots and causes of poverty and inequity. The Gates Foundation is a private philanthropy committed to all of the work that you all are doing and trying to emphasize its comparative advantage during a crisis like this. We're committed to testing and scaling innovative solutions to the most pressing health and development challenges normally, but in a crisis, we're able to really step up. The foundation has committed more than $300 million to support COVID-19 response efforts with the chief aim of protecting vulnerable communities. We're in a unique position to help invest in ideas and innovations and initiatives with the potential to save lives, and have been collaborating with governments and industry from the outset so that successful solutions are more likely to be taken. We're accelerating the search for effective coronavirus vaccines and treatments to ensure that, and this is important, once available, they can be delivered quickly and affordably to high-risk populations and populations where economies will not support the initial development of the vaccine. Making this a priority is critically important to us, and it differentiates our position in a world where there are many participants in technology development in this area. The foundation is partnering with modelers and working on developing accurate data to collect and help inform governments for effective action. Without that information and those investments made now, we won't understand as the viral pandemic rolls out, and how to inform and help governments make easy, effective decisions about where to target their interventions. The foundation remains committed to protecting the health and well-being of women and children. As an obstetrician gynecologist, I help them to drive that through our maternal, newborn, child health work. We know that essential services, as many of you have pointed to, the indirect effect of coronavirus that affect essential services include all of the disruptions that encourage women to not attend the services we know are life-saving, but step back from them. And it's our opportunity to increase the strength of those health services. These also include family planning, maternal, newborn, and child care, but also, as my colleagues have mentioned, nutrition, which is so important to pregnant women and children as they begin their journey, their long journey down a path towards better health and improving their socioeconomic status. We work to ensure access to safe, quality delivery care and maternity services attended by skilled health workers, as well as antenatal and postnatal services, to ensure that women and girls can access, as I said, contraceptives, counseling, and information as a part of their routine care. These must be included in essential service guidelines to protect routine childhood illness treatments, such as neonatal sepsis, pneumonia, malaria, and diarrhea, and routine childhood immunizations, critical parts of the puzzle to ensuring a healthy life in the future. In the long term, countries will need to continue to invest in and strengthen primary healthcare systems and improve the quality and care provided through essential health services. This pandemic requires that all sectors work together and do their part so that results come faster and reach more people. And it's that which is ultimately our way out of this pandemic. Thank you for giving me the time to speak.
Thank you so much, Dr. Pollack. We really appreciate your medical and professional advice. We now turn to the United Nations Secretary General's Youth Envoy. We've seen her at UN headquarters. She's been around. She connects with the youth around the world. I present to you Ms. Jayathma Wickraman Ayake, the UN Secretary General's Envoy for Youth.
Thank you so
Jayasma,
much.
you have the floor. Absolutely.
Thank you, Pamela. Thank you for also attempting my last name. Not a lot of moderators do that. So a lot of the things that I wanted to say have already been said, so I'm not going to repeat any of that, but I just wanted to make the point that a lot of the issues that were discussed today here that affect women actually are amplified for young women and girls and adolescents by the age factor, particularly for girls and adolescents who live in hierarchical, patriarchal, traditional societies where it's even difficult for them to raise their voices and stand up for their own rights. And even before the pandemic, girls and young women were disproportionately affected, particularly on issues such as child marriages, female genital mutilation, lack of access to education, unpaid domestic chores that they were doing compared to their male counterparts. And these all have been increased and exacerbated. And one of the fears that I have is that similar to what we saw after the Ebola pandemic, the increase of child marriages and increase of teenage pregnancies, we might see that as well, as all the indications predict. And I think we have to keep that in mind to make sure that these girls and young women do not fall through the cracks as we talk about responses, but also the recovery plans for COVID-19. And on that, I wanted to make 3 points. And the first one was on the access to sexual and reproductive information and services. Unfortunately, a lot of the adolescents and young people do not get the information they need on sexual and reproductive health from their homes or from the formal educational system. So they used to depend a lot on peer educations, youth clubs, health clinics in the communities, schools and universities. But now all of these have come to a stop. So we need to rethink how we actually provide this information and services to adolescents who are quite curious as they transition about their sexuality, as they transition from childhood to adulthood. So these solutions has to be designed together with young people themselves. And secondly, I think the mental health of adolescents and young people is extremely important. That also has a specific gender dimension into it. Suicide was already the second leading cause of death among young people between 15 to 29, and that risk has again increased because of the pandemic. And I think as much as we invest in physical health, we also need to invest in mental health and making sure that adolescents and young people get the access and information they need to understand mental health challenges, but also find solutions to them. And thirdly, as we discuss long-term solutions and progress on development and sustainability, it is so important that we have these conversations intergenerationally if we want to make sure that they're sustainable. So even conversations like this has to have girls' voices in them. Every conversation has to be intergenerational and the solutions have to be intergenerational. Therefore, I urge all the women leaders who were here today to think that the future is not just female, but the future is also intergenerationally female, and include girls and young women in all your work as a co-part. So thank you very much.
Thank you very much, Jayasma. What I can tell you from you being at UN headquarters and watching Ms. Rikmayanayake walk around is that she's usually followed by a parade of young people very devoted to the cause. So thank you for being the youth envoy. We've had a vital discussion today by all the participants on the need to protect women, children's, and adolescent health and well-being. I'd like to turn to the co-conveners to close this meeting and invite all of you watching around the world at UN headquarters, wherever you are, to showcase your ideas. There is a challenge with a short video, and go to the website of Every Woman, Every Child that has more details on that challenge. There's so many dedicated, unwavering commitment leaders in these panels advancing the agenda. And I'd like to, before we turn to the co-chairs, thank Every Woman, Every Child, all of the leadership, as well as Vivian, Gaviana, Natalie, all the staff that makes an event like this happen, the Partnership for Maternal, Newborn, and Child Health, the Government of Norway, Women Deliver, all the government leaders who were here today. So I now turn to the co-conveners. We thank them once again for the unwavering commitment. The President, Kersti Kaljulaid, and the Right Honorable Helen Clark. You have the floor.
Thank you.
I defer to the President first.
Yes, I'm sorry, the President first.
Thank you. And thank you all for your very practical suggestions. And also thank you for the worrisome statistics, because unless we really look the facts on the ground, we cannot create any movement based on these facts. And many of you said that we will see how the pandemic impacts, etc. And I have a message to you. We will indeed follow up. In July, the EWEC steering committee will follow up. And again in September during our General Assembly. We are keeping moving in a quarterly framework in order to make sure that we keep the pressure on the society and we keep achieving concrete results for the future. And finally, we have long known that we can only succeed if we are all together, governments, civil society, non-governmental and private actors, and this day today has demonstrated this is indeed the case. Have a nice day, have a nice evening or peaceful night. Thank you all for participating.
Now the Right Honourable Helen Clark.
Well, thank you everyone for all the expertise and different perspectives which have been brought to the discussion. Obviously, we're all advocating for the needs of women, children and adolescents to take centre stage in the responses. I think if we look at the bigger context, we're nowhere near where we need to be as a world with a globally coordinated response. This pandemic is bringing economic collapse. Economies stop, subsistence livelihoods are eroded. Families are going very, very short of food. Essential services stop. More than 100 countries have applied to the IMF for emergency support. It can't fund it because the package that would make that possible has been mobilized. So as we advocate for women's needs and rights, let's also make our voices heard for a genuinely globally coordinated response at scale. And if you compare this with, say, the global financial crisis, where we faced a lot of the same risks of collapsing budgets and services, that needed a $1 trillion bailout. I'm seeing figures now, and I think Kristalina Georgieva herself may have used them. We need a $2.5 trillion bailout if we're going to, move ahead and not see economies, budgets, livelihoods collapse. When the ILO says about half the informal economy jobs are at risk, something very, very serious is happening. So keep shouting as women, keep advocating for those who do have the power and resources to make a difference, to make that difference and make it for women, children and adolescents. Thank you.
Thank you, Prime Minister. Thank you all for being here today. Thank you to all the panelists, to the organizations, to the women leaders, and thank you for watching.